everybody, my name is Natalie, and I feel really thrilled to be here to be able to talk to you a little bit about what it takes to becoming a diagnostic medical sonographer and, in general, what all that job entails. This might spark your interest if you're interested in learning more about the healthcare field and different opportunities in that field. And if not, it's fine. This can help you gain some insight that may or may not be beneficial. But in general, you'll be more well rounded. So, I did not, to be quite frank, I did not always want to be an ultrasound technician, sonographer, also known as diagnostic medical sonographer. I didn't always want to be that. For as long as I can remember, I've always wanted to be a nurse. My aunt was a nurse. She would take me with her sometimes to her job. My mom studied nursing, and it's just something that I've always wanted to do. I love I love what it can do to people. I love how it can help patients. And I just feel like there's a lot of people who do not like their jobs. And if I could be one of the few that do like their jobs and it shows with my work ethic and I can help touch someone's life in a positive way, then that for me is my purpose. I feel that in my heart. Aside being a mother, which is my number one purpose in life and my number one responsibility, definitely working in the healthcare field as a nurse. However, because I am a mom, a single mom, I cannot compromise myself to devote myself solely into nursing school. There's a lot that goes with becoming a nurse, and right now, this is my plan to become a sonographer. And who knows, maybe later down in life, I'll be able to do that, being that as a sonographer, I will have more flexibility. I won't have to work so much because I will be making more money. Um, Maybe I will be able to become a nurse one day, and it would be of a great benefit for me and my daughter. But for now, I'm very happy to keep learning about being a sonographer. I love the job itself. It's also very fulfilling, and I look forward to the day that I can work in that career. So here I have a journal. In this journal, ever since my daughter was just a couple months old, I would write in it. So um, this is where I safely keep these pictures. This is my daughter. This was me when I was around the same age, so you can see the resemblance. And yeah, here's where I keep these pictures. This is the day that I was able to find out the sex of my baby. This was a glorious day. It was on August 9th, 2017. I found out that I was having a girl. Me and you cannot tell what the sex of the child in here is. However, a sonographer could tell instantly. And I just remember her being so kind with me, gently lubricating my belly, operating the machine to then confirm the sex of my baby. That was one of the best highlights of my life. And I feel like that's the day that, okay, there was a spark in me. Like, I could see myself doing this. I can see myself, really doing this. It's beautiful. It's a beautiful career, and she made my day. I want to do that. I want to do that for someone else. Say you do not want to work only in a private clinic at an OBGYN. There's so many different environments that you can work in. It could be at a hospital. It could be, at a doctor's office. There's just so many different places you could work in. You can work at a hospital again. So, I mean, it's great. There's a huge, wide variety in this, and honestly, it is very fulfilling. So yeah, I want to describe this career path a little bit, the benefits and how important it is to pay attention to small detail. It's important to pay attention to small detail because, say, a patient comes into the hospital, they're not feeling well. You want to be able to get a clear and quick diagnosis for this patient to potentially help them to the best of their ability, and oftentimes the quicker the better. So also what comes into it is being able to visualize internal organs. You have to be well-rounded with anatomy. That's why it is, say, a longer course, 2 years, 18 months or so. It's important because these are human interactions we're dealing with. This is their health on the line. And it's something to be extra cautious about and definitely very mindful about. So a sonographer will be operating imaging equipment and reviewing the images to be sure they're of good quality. Also, when preparing patients for procedures and educating patients throughout the ultrasound exam, that's a very important job duty that a sonographer would have to do. You'd have to review their medical history, also help with billing, and make sure the maintenance is kept up with the machines you will be operating. It's a lot of responsibility at hand, but when it's something you love, you would do it gladly, and that's something I wholeheartedly believe. So yeah, we're going to be working with doctors, nurses, and patients of all ages, infants even, and it's very neat. You're not going to deal with the same thing every single day repeatedly, and that's also good too. If you're the type of person that maybe gets bored easily, this might be the job for you. This job is actually growing. It's been growing 16% since the year of 2016, and it is projected to keep growing up until 2026 is the projection. And I mean, annually you could be making a median of $71,000 a year. So not only is the pay well, but it's a job that is in high demand. It's a job that could be of big help to people, to everyday civilians, a mother that is expecting, and it's something that is definitely very interesting. So predominantly, if you were to become a sonographer, you would work in a hospital. It's a very hands-on job. You're going to have to be with patients, being interactive, on your feet, probably most of the shift. So that's something you'd have to mentally prepare yourself if that's not something that you're very much into. It is something that comes with the job. You have to have good hand and eye coordination, I'd say accuracy, and ultimately a soft hand, so the patient doesn't feel like it's something you're rushing, more as something that you are determined to do well to your best of the ability. So I mean, I'd say that if this is something you take interest in, you should go for it. I know that sometimes I feel like giving up. Sometimes I feel like this is too much to take on. But, this is not just for me. This is for my daughter. This is for patients that need someone who loves their job to help them, that wants to help them, that actually cares. It's not just about me. And if this is not the career path for you, that's fine. I challenge you to chase a dream that sounds too far-fetched, to chase a dream that you want to do, something that will make you happy, and go for it. Thank you so much. I hope you've all learned a little bit of what it takes to become a sonographer, and that you can relate. Thank you.